when patients are in crisis and they're not doing well, they end up needing to go to the emergency department in order to be assessed and to resolve this crisis. When these patients show up in the emergency department, particularly if it's after hours, emergency doctors or psychiatrists will not have access to patients' healthcare providers. And sometimes that causes delays in providing the treatment or appropriate treatment for these patients.
What I would see in some of our quality of care reviews would be that information did not flow to match the service that was needed for the client. So very often when we did a retrospective review, you would see that lack of that right information at the right time with the right service provider actually compromised care or did not give that person the best care possible.
When patients get discharged from hospital, for example, a lot of times they have an appointment to see their primary care provider or their psychiatrist very soon after, before we're able to provide a discharge summary or something, or a report outlining what happened in hospital. And that delay could be very difficult for their healthcare providers in the community.
The Mental Health and Addictions Information Exchange is a mechanism to get the right information at the right time with the right people so that their continuity of care is not compromised. It's not only unique to the Guelph Wellington OHT, it's actually a proof of concept that is one of its kind in Ontario.
The MHAIE is actually a very unique project, and I believe it's the first of its kind, where there's 3 organizations on a similar platform that are coming together. It's not allowing full access because then there'd be privacy issues and consent issues, but it's an instance where we can see specific information like demographics or client enrollments, and we can use that to do our jobs more effectively. And so it's unique in that usually you would have your own instance of that, and we're actually sharing one. So it's kind of forging ahead in a new way. It's going to link the 3 large organizations in this sector and be able to share information quite easily and remove barriers like phone calls and faxes and chasing information.
So who will be using it will be all the service providers involved. Now the beauty of the Mental Health and Addictions IE, it has a consent management overlay. It's set up that you only will see the information you need to see in the role that you have. So if you happen to be the physician of choice, you'll get to see it. If you happen to be the social worker, or if you happen to be one of the OTs, they'll see it. But if that person says, I don't want that OT to see it, it won't show up to that OT. Like it actually is privacy by design.
Well, ultimately, the clients are going to be the ones who benefit from this shared information exchange. They're going to see service happen faster, assessments happen faster, intakes, less stress for them. Of course, it will also help our staff and the partner agencies because we'll be able to do our work quicker and more efficiently too.
We can just look it up and know they've been discharged, this is their medication, this is their transitions of care, and then it is that continuity of care. It's what you tend to get in medical, but you don't always get it in mental health and addictions.
It will avoid medical errors. It will avoid also patients not getting the appropriate support that they need in order to go to their next stage of treatment. Patients don't have to start from scratch every time they show up at one of the different facilities. We're in some way practicing more preventive care versus reactive care, providing better care for patients, at the same time balancing that with the privacy, that maintaining patients' privacy.
I think the OHT is really looking to forge ahead and find ways to do things better, more effectively, harness technology, and ultimately make the experience for the patient better. And so this is one of those projects that will do all of those things.
First of all, if it wasn't for the Guelph Wellington OHT who sponsored the project, we would not have had the resources. Resources for a project of this size, especially a proof of concept. They advocated for us with Ontario Health, and they believed in it.
All the physicians that I'm working with have been very, very excited about this initiative. They recognize its importance, and the statements that I hear, it's way overdue. A lot of the physicians, a lot of times, are looking for ways of being able to obtain more information, and for them to know that they can access that again in real time while they're seeing the patient and not having to delay patient care is definitely something that they are very looking forward to. So it's all very positive feedback.
Yes, it's been really exciting to see this project come to fruition in the next few months as we're getting ready to launch. We've been working on it for quite a long time and working with 3 partners and getting all our systems together. So it'll be very gratifying to launch this project.
It is definitely going to enable safe, quality care for our clients.